This first story is a reality you've probably faced multiple times. Anytime you need to get into a doctor, you usually have to prepare to wait days, weeks, or sometimes even months. It's widely reported that the country is suffering from a shortage of primary care doctors. The problem is severe in the Hoosier State. The federal government designated Indiana as one of the most underserved states in the U.S. A number of factors are accelerating the problem, but this year's first graduating class from Marian University's medical school in Indianapolis could help reverse the trend. Rachel Gahagan and Trenton Smalley are part of the first graduating class from Marian University's medical school.
I've enjoyed all areas of medicine throughout medical school, whether it be pediatrics, through geriatrics, doing OB, sports medicine, emergency medicine. You get to do all that as a family medicine doctor.
130 aspiring physicians will receive degrees Sunday, and of those, nearly half are focusing on primary care in Indiana.
It's a great place to practice medicine. I think people here are genuine. I think they're caring.
Gahagan is doing her residency in pediatrics at Peyton Manning Children's Hospital. From there, she hopes to stay in Indiana and continue practicing.
There's a strong sense of community amongst Hoosiers, and I don't think you find that everywhere.
This is significant because a recent study from the National Healthcare Policy think tank Robert Graham Center found that to maintain the status quo, Indiana will need more than 800 additional primary care physicians by 2030.
It just tends to get worse and worse and worse.
Indiana's population is aging as it grows, and more people are getting insurance through the Affordable Care Act and Indiana's expansion of Medicaid, known as HIP 2.0.
There is not an area of Indiana, city or town, that doesn't have a shortage. And I'm talking about right here in Indianapolis. It doesn't matter where you live.
Nationally, Indiana ranks 38th in the ratio of physicians to patients. The statewide average is more than 1,500 to 1. But the problem is exacerbated in rural areas. Newton County and Warren County have the highest primary care to patient ratios in the state. Each one has only one primary care physician in the entire county. Feldman says increasing training and the number of medical schools in Indiana go hand in hand with more doctors practicing in the state. There's a federal initiative led by the Association of American Medical Colleges to increase med student graduation by 30%. Indiana University exceeded that goal, but the big story, Feldman says, is Marian University.
And that's a game changer. It changes the whole dynamic in this state. And now we're going to further our goals of getting enough physicians, particularly primary care physicians, to practice in Indiana.
Some states do offer incentives to med students. They'll forgive their student debt or offer dedicated funding for primary care residency programs. Indiana does have a loan forgiveness program, and although it's in state statute, it doesn't receive any funding. That aside, Schmally and Gahagan still say it makes sense for them and their careers to stay in Indiana. They've made valuable connections during their 4 years at Marian.
That's the biggest incentive for me, is to continue to stay here and work with those physicians and learn from them, and then later go back and give back to the community that helped me to kind of have the success that I've had.
Medical school enrollment is up across the country as universities expand their curriculum and more schools like Marian open their doors. The next big hurdle is the lack of residency options or positions. Graduates can't go on to become practicing physicians until they complete their training in a residency program. But Congress hasn't increased funding for these positions in more than 20 years, creating what Feldman calls a bottleneck of students with, in a sense, nowhere to go.